I must say, this residency series is coming along very nicely. What's going on, everybody? My name is Eli, and welcome back to my YouTube channel. So for those who are new here, my name is Eli. I'm a second year dental student at Boston University. On this channel, I make vlogs of my dental school journey, as well as videos with advice for pre-dents who are looking to get to dental school. So if that's something that's interesting to you, please make sure you subscribe to the channel, share the channel with anyone who might find it interesting, like the video, comment on the video, etc. So on my channel recently, I've been doing a vlog series of day in the life of residents. And I've had people from different dental residencies come on the channel and explain what a day in the life looks like, as well as vlog throughout their day at their respective residency programs. If you're new to the channel and you haven't seen any of these other videos, I have a playlist that I'll link at the top of the screen somewhere here, and you can check out the residency vlogs for endodontics, AGD, pediatric dentistry, OMFS, in today's episode, as well as the future episodes that come out. So if you're ever interested in finding that, just go to the playlist and scroll through. Today's episode will be a day in the life of an orthodontic resident, brought to you by my friend Dr. Alicia Briscoe. Me and Alicia went to undergrad together, so I've known her for a long time. And she has always been one of the people that I knew that were interested in dentistry from the jump. So I asked Alicia if she could share what a day in the life at her dental residency looks like. She's an orthodontic resident at the University of Maryland School of Dentistry, and she did a really good job recording her vlog, including a lot of content, letting you guys know what her day looked like and what a typical day as an orthodontic resident at her program looks like. So without any further ado, check out Alicia's vlog.
Hi everyone, my name is Dr. Alicia Briscoe and I'm a first year ortho resident at the University of Maryland School of Dentistry. A special thank you to Eli for asking me to kind of take you guys along with me today as I go through my day. So a little bit about me. I was born and raised in Bowie, Maryland. I then went to University of Maryland College Park for undergrad, where I majored in general biology. I then went straight to dental school at about 45 minutes north of my undergrad to Baltimore to University of Maryland School of Dentistry. And I just graduated in May, and then I'm here again for ortho. Obviously, couldn't get enough of Maryland, so that's a little bit about my journey. And I wanted to be done sooner rather than later for myself, and that's not everybody's cup of tea, but I just wanted to be one and done, hopefully, and I kind of made that happen. So, why I chose ortho. I feel like I've always kind of been a person that was like, I want to be really good at one thing rather than being like okay at a lot of different things. So that's kind of why I decided to specialize, because I just wanted to be excellent at one thing than kind of like stretching myself thin by doing too many things. Also, my mom's an orthodontist, so she introduced me to dentistry overall. And then I was like, you know what? Yeah, she's ortho, but let me kind of go through dental school and see if I'm open to doing anything else. And it brought me back to ortho. And so the reasons why I did ortho is because I really do appreciate working with what you got. So in this day and age, I feel like everybody's just shaving their teeth down and slapping crowns on there or veneers. And I just feel like nobody really gives themselves a shot. And so I think with orthodontic treatment, you just give yourself a shot. And if you know you don't like it after the little bit of time, maybe 1 to 3 years that you have braces, then okay, you gave yourself a shot. Now just put veneers everywhere if that's what you need. But I really do like that you're working with what you got. And I also like that it's very cerebral. So a lot of times we are envisioning what things could look like. So we are envisioning extractions. We're envisioning if we do this with teeth, how does it affect their face? How does the face affect the teeth? Like, do they work together as a unit to give an overall good appearance? And so I really do like that. It's very just mind heavy and brain heavy rather than physical. Also, I like that it's delayed gratification as well. So not only do you like see little kids and you see them grow up and you're like, okay, you were a little kid 5 seconds ago and now you're growing a mustache and you're towering over me, but you get to watch their emotional growth and their mental health grow because they're becoming more proud of the smile that they are now developing. I also love that a lot of adults are actually getting braces and Invisalign as well and kind of improving themselves. And I like that ortho a lot of times is involved in other treatments. So with adults, a lot of times they need prosthodontic work. And so we're kind of working with the prosthodontist about how we can make the teeth in better occlusion or make enough space for like an implant or something like that. So I like that we kind of are interdisciplinary with our treatment care. So with the match, oh boy, it was very, very stressful. Some important things to kind of note about the ortho match is, yeah, it's scary, but I can't say there's like a GPA requirement or a rank requirement because who really knows what it is? The only thing I kind of know is that you need to take the GRE because some schools are master's awarding. So Maryland is a master's degree awarding program. So we had to take take the GRE, excuse me. So you just want to do as well as you can on that, just so that you check that box. And in terms of picking the schools, there's about 60 something programs in the country. A lot of the programs don't really have too much differentiation on their website about what they have and don't have. So I feel like when I was picking, a lot of it was location. Do I know anybody that goes there? What kind of technology do they have? And just applying to as many schools that I could afford in hopes that, something would work out. So a little tip about that is that even if you feel like you're not qualified, I know everybody hears like little things about what you need for ortho, but I feel like you never know what they're looking for. So some programs I was like, oh, I'm definitely not getting an interview. I got an interview for ones that I was like, oh, maybe I would get an interview, and I didn't. So I just say go for it. You never know what the outcome could be. So always try. You don't count yourself out before they count you out. And even then, try again. So that's what I would say about that. And if you're unfamiliar with the match process, you apply to these schools. And from what I heard during my interview process, it was about like 400 applicants per school, then narrow it down to about 30 interviewees, and then it ends up being 4 to 5 residents. So you feel very, very privileged to be here. And it's gonna be great. So if you're thinking about it, definitely go for it. It's gonna be a great way of life, and it's kind of low stress and high reward. So, all right, I will take you guys with me today, and I hope you enjoy. So this is the dental school and where I go to residency. Okay, so we had cadaver lab today from 9 to 11. First years we start off with having gross anatomy in the spring semester. So we have that Monday, Wednesday, and then the remaining time we have patients. So just finishing a patient that had a bracket that came off, and then I have a few patients later as well, one for an attachment off of Invisalign and the other one for treatment planning of a expander, and then just telling the patient and the parents what kind of treatment we expect. And that patient actually has an impacted upper left central incisor and an impacted canine. So it's going to be a really interesting case. So I'm excited about that. So see you guys in a little bit. Something that's really nice about our residency is we actually have 3 ortho assistants. In dental school, I remember I was the front desk, I was the dentist, and I was my own assistant. And so we don't really realize how important assistants are until you have them. And I actually have one right here. This is Denisha.
Hello.
So tell us a little bit about what you do for us and how you make our lives a lot easier.
So here as an ortho assistant, my role is to be a support system to our residents. And what we do, we don't do as much hands-on with the patients as in a normal orthodontic office setting, but we support our residents by making sure that they have everything that they need to see their patients. We take all their x-rays, we prepare their tables with all the instruments that they need to see their patients. We just provide a more supportive role while they're seeing their patients, getting their arch wires, seating their patients, choosing colors sometimes for their patients, and just being a helping hand. Our role is more on the supportive side, and I keep saying supportive because a lot of times when they come here, they're used to not working with us. So we try to give them an experience softwares, or when they get their own practice, that they know how to utilize their assistants to best support them.
Yeah. So as you just heard, they're so important, and they really do help us along this residency program. So I'm gonna keep you guys updated with how my day goes. But there we go. Not least, we have our third-year resident, Jeremy Doc, who can tell us a little bit about what this residency has to offer.
It's a very serious residency, clearly, here. But we like to have our fun, but also take things serious and treat our patients well. But things have been good. I'm 5 months away from kind of going to the real world and getting out of school.
What have you done today?
Today, it's a pretty easy day. We have just regular patients. Actually, we got really lucky today. Normally, we have seminar where we go over patients and stuff from 8 to 9. But today, we just started at 9 o'clock and saw just a morning full of patients, just normal adjustments.
Very good. And then what have you learned over the past 3 years? Like, what kind of things have you done, just to tell the people?
Sure. So I love this residency because we do so many different things and get a lot of different techniques from a lot of our different faculties. So, you know, a lot of times we're putting mini implants or TADs in patients. We're doing class 2, class 3 bite correctors with functional appliances, and I've had a ton of surgery cases, which is a great experience. And so you name it, we're trying all the new things here.
Right. And then where are you heading in 5 months?
Back to hometown of Cincinnati, Ohio, working for my childhood orthodontist. So that'll be, life comes full circle, really, when you do that.
All right, love it. So that's the third year, and we'll keep it going. Thanks. You guys heard from me as a first-year resident, but I also have my co-resident, Dr. Grace, to tell us a little bit about what we do today, day to day.
So today, for example, I'm sure you already heard, we had our first dissection course, which was really cool. Alicia and I are partners, so we each got to dissect one half of about, like, clavicle up.
Yeah.
And then afterwards, we came right to clinic. And for example, my schedule today, I got to remove some Invisalign attachments for a patient that is transferring from Invisalign to regular braces because he wasn't wearing them. And then this afternoon, I have a treatment planning appointment and an initial bonding. Should be really cool.
Yep, and that's kind of what you can expect day to day, is some class and some patients. All right, thanks, Christina. So now we have a second year, Dr. Tellis. He actually has an interesting perspective because he's actually an orthodontist from Brazil. So Dr. Tellis.
Hello.
So tell us a little bit about what you've done today.
So today was a very exciting day for me because I saw an Invisalign case that's progressing very well. It's a big open bite that we're closing. And I did my first stats in the residency, which was very exciting and worked very well too. So today was a great day.
Great, love it. Thanks, Dr. Tellis.
Thank you.
Finally lunchtime, and I'm currently in the residence room shared by the pediatric and ortho residents. And we often come in here for lunch or just to kind of hang out between patients. So I'm gonna tell you guys about what my day's been like so far. So usually from 8 to 9 on pretty much every day, except for today, we have a treatment planning seminar where the first through third residents, we come and we talk about a case. And the first year ortho residents will say extraoral diagnoses. The second year ortho residents will say, some intraoral diagnoses. And then the third year residents will talk about treatment planning options. And so we kind of have a discussion for an hour about what we would do. And then the presenter will say, okay, well, me and this faculty treatment plan this patient this way. And then they'll sometimes show some progress photos, which is really cool to see. And like I said, we had cadaver lab. This was the first day, and it definitely was like a blast from the past to do 1 year. So we had that from 9 to 11. And then at 11, I had a patient. And so we usually have lunch at 12 until 1. And so we come here or go wherever just to kind of hang out and eat. But today we have a lunch and learn. So you're going to see me kind of walk down there in a little bit. So let me look at what Eli sent me. So my residency program is University of Maryland School of Dentistry in Baltimore, Maryland. And it's actually a 3-year program. And it's I don't know if it's a dual degree or how you call it, but basically we get a master's in oral biology and a certificate in orthodontics. So we take master's classes, i.e. gross anatomy. So those classes are not really often, maybe 2 or 3 times a week for like 1 hour or a couple hours a day on those days that we have them. So it's not that bad, but most of the time we see patients. How it's different than dental school is that we really do focus on the malocclusions and how it affects the person's face and stuff like that. So a lot of times we are looking at the extraoral soft tissues to kind of evaluate how we can move teeth to make them fit while also preserving a good aesthetic look for the patient, which is very much also reliant on ethnic standards. So that's really cool. We do a lot of different techniques like TADs, which are basically little screws that we put into the bone to kind of move teeth in the way that we want them. We've learned about headgears. We've learned about indirect bonding of brackets. We use clear liners. We have an in-house clear liner printer, things like that. And what else? Ceramic brackets, traditional brackets, soft self-ligating brackets. So we have a really wide variety of things that we're doing. So I think that's really nice. We have phase 1, phase 2. So we do expanders and things like that. Also preparing for like surgical cases. So I think that's really awesome. And I've learned a lot since dental school. And I think a lot of what residency is self-learning. So yes, they do provide us with the tools that we need to learn. However, because this is like a specialty and this is something that you really, really want to do, you kind of do your own research to kind of educate yourself in something that you're passionate about. So I think that's what makes dental school different from residency, is that, at least for me, I felt like ortho was so interesting to me that I wanted to learn more, versus dental school, I was like, I just want to get out of here so I can do what I actually want to do. So yeah, I think it's been a good time for sure. I'm not too thrilled about anatomy, but it is what it is. So I guess now we're gonna go to lunch. So see you soon. I'm with my co-resident, Dr. Steven Zinn, and he's gonna tell us what we're doing right now.
Right now we're on our way to Lunch and Learn. So at Lunch and Learns, companies come to tell us about their product and sometimes even give us free samples. And the good thing is it always comes with lunch.
All right, I'm very excited. We'll see what we're eating today for lunch. Thanks.
I can take this.
All right, so lunch was great. And now I have my last co-resident, Dr. Treeley. What are you about to do today?
So for the afternoon, I only have one patient today. I'm about to do a records appointment. So it's kind of like the second step in the treatment process for patients. So first I go through a screening with pre-doc students, and then this is the second step. We're doing a record, so we're kind of like taking diagnostic photos, taking x-rays, looking a little bit closer in their mouth to see what malocclusion they have and what we need to do for them. So
very good.
Afterwards, we're gonna do a treatment plan, and then we'll go from there.
All right, sounds good. Let's do it. So I'm just leaving school. It's about 5:19. This is pretty late for when I normally leave school, because I normally finish at around 4. So I'm about to go home, and then I'm gonna head to the gym. So I'll show you guys a little clip of that. All right, guys, I'm going to the gym. So I try to go 3 to 5 times a week. But I mean, who's counting, right? Because I think it's important to kind of maintain, you know, your back and all that stuff with dentistry where you're sitting down all the time. And also we have fitness goals out here. So I'm going to gym first, and then actually I'll show you guys me going to bachata class with my co-resident. And so that'll be fun too. So just remember, residency and dental school and all that stuff is not your whole life. So have fun for yourself, and I'll show you guys a little bit of that. Bye. Well, that's all, folks. Thanks for coming along with me today, and I hope you found my vlog enjoyable but informative. For those of you who are interested in doing ortho, best of luck to you. You guys got this. For those of you who've been watching Eli's series as a way to kind of figure out whether general dentistry is for you or maybe one of the dental specialties, I hope you found ortho to be the key to your heart and you joined me. But even if you didn't, I hope this video helped you kind of make a decision or steer you in the right direction to a decision that's the best one for you and your situation and your passions and goals and things like that. If you have any questions, feel free to reach out to me on my Instagram. I'm sure Eli's gonna tag it here at hey_it's Dr. Alicia with 2 A's. Again, best of luck to all of you, and I need to go study anatomy now, so Dr. Briscoe's out.
Man, shout out to Alicia for that super interesting, super inspiring vlog. I know that orthodontics garners a lot of interest from dental students and pre-dents, so I do think a lot of people are going to enjoy watching that vlog. I definitely enjoyed watching it and see what a day looked like at her school and her orthodontic residency, and I'm happy that Alicia decided to do the vlog, because I know a lot of people get nervous about recording themselves or recording themselves as in public or at school, etc. And I think Alicia did a really good job, especially just like being herself and talking on the camera and really explaining things. I definitely think, you know, the vlog was really nice. So thanks again, Alicia, for doing this. Thank you everyone that watched the video and enjoyed the video. Make sure you drop a like on the video if you enjoyed it. I realize that a lot of people watch my videos on their phone or on the TV and not really on the computer like how I use YouTube. So if you just click like up on your TV, like the up arrow, matter of fact, I just happen to have my Fire Stick remote right here. So when you're watching on YouTube, if you click this up arrow right here, it'll pull up like my little face, my picture, and like a whole bunch of stuff, and you'll see a thumbs up button. Just scroll over, hit the thumbs up. It's free, it takes 5 seconds, and it really helps the video out. So thanks for watching, thanks for liking the video, and I'll see you guys in my next vlog or the next dental residency episode in the series. Peace.